Video 2, ladies and gentlemen. This time we're looking at how do we assess the overdose patient, how do we adapt our assessment techniques, and what kind of extra questions should we ask about someone who's potentially OD'd. So you'll find that we don't teach a specific targeted toxicological assessment like other pathologies, and that's because tox emergencies can cover a whole range of body systems. So you'll really need to pull together other assessments to properly treat a tox patient. That being said, there are some things we need to add in order to be effective. Starting with our scene assessment, make sure the scene is safe. Things like open sharps, broken glass, or fumes can all be hazards, especially when we think about contaminated or dirty sharps. Besides those things, also be on the lookout for signs of drug labs. Things like exposed wiring, extension cords that all run into one place, open gasoline or other chemical containers that really don't belong in the scene. All of these are signs that you're in a drug lab. And then you should be worried about fumes, fires, explosions. Best thing is just to stay away. Also involved in that scene safety, look at who's in the room. Drugs can make even really calm people get pretty wound up, so try and read body language as best you can, but be mindful that patients on drugs may not react like a normal person would. Also make sure that there aren't people hiding around the scene who could jump out at you and harm you guys. Having police on scene during a possible drug overdose, especially recreational drugs, is likely a good idea. Moving into the ABCs, nothing really special here. Watch for secretions, and if there's any vomit in the airway or anywhere else, have a look and see if there's any pills in it. One note on breathing. Obviously manage the breathing of any patient who needs it, so slow and shallow respirations give them a BVM, but maybe slow down a little on the advanced airways, especially if you think narcotics are involved. Narcan is a quick-acting reversal agent, and if the patient wakes up with an eye gel in their mouth, they may not be happy. So basic airway maneuvers first when possible until we get a game plan. When looking at questions we may ask the tox patient, try and get as much detail as possible. Big questions are what they took, how they took it, when, why, and how much. There are 4 main routes for getting drugs into the body: inhaled, injected, ingested, and absorbed. Each has their own pros and cons or inherent risks, so it's important to understand how the patient was exposed to the drugs. Also ask about medical history. How long have they been on these drugs? Have they built up some kind of a tolerance, or is this their first time taking these kinds of meds? On that note, when someone tells you they took some pills, or they show you a bottle of their pills, have your partner count and verify how many pills there are versus how many there should be. Look at the date it was filled and count out how many should be missing. Sometimes people over or under exaggerate how many pills they've taken, so it's important to get a really good count. Lastly, we're looking at the physical assessment. Pupils are always a great spot to check for signs of drugs use, like pinpoint pupils meaning narcotics. We'll touch more on the specific signs of drugs in the toxidrome lesson. Moving through your head to toe, look for signs of drug use, like old and new track marks or medication patches. If you see any patches, remove them carefully and document where you found them. Try and figure out the patient's weight, either by asking or just making an educated guess. Toxic doses of medications are calculated by milligram per kilogram of body weight, so figuring this out is crucial, especially in kids. So once we've gotten all that information, what are we going to do with it? Well, my first advice is always to call a grown-up. Every province has their own, or access to another province's, poison control center. These are physicians and RNs who specialize in treating toxicology emergencies. They'll ask you some basic questions, things like what the patient took, how much, when, their body weight, and the current vitals, and then they'll give you a treatment plan. If it's something that doesn't fit with your current protocols, or it just doesn't fit in your system, no worries. Call online medical or a supervisor and relay the message. They may say follow their advice, or they may say skip it and go right to the ER. Either way, you're covered. Common treatments we'll see in the field will be around symptom relief, unless we have an antidote like Narcan to administer. Activated charcoal isn't routinely given pre-hospitally anymore, but it's a great thing to be familiar with. Typically 50 to 100 grams PO, activated charcoal does 2 things. First, it causes the patients to vomit, helping remove any pills in their system. And second, charcoal molecules are very coarse, which cause the drugs to bind to it and follow it out the GI system, preventing them from being absorbed and metabolized. It's important to note that charcoal won't work on all meds, Things like alcohols won't be affected by charcoal, and if it's been over an hour after the ingestion of the pills, it's typically not effective. Still, if you have it in your truck or in the clinic or in your ER, call poison control and see what they say.